They're just connecting, getting their recording going. All right, we're good to go. Yep.
The broadcast is now starting. All attendees are in listen-only mode.
Good morning, and welcome to Same-Day Service for People in Need of Food. I'm Kim McCoy-Wade, and I'll be hosting this webinar this morning. This is the third in a series of 3 webinars on strategies to boost participation in CalFresh. Each time we've had more and more people sign up and join us, and we're thrilled to have over 150 people RSVP, and I'm watching the counter break 100 now as 100 people join us on a rainy day here in Northern California. We are also thrilled by the mix of people. We have, I lost count how many counties are represented on this call, but I'm going to go out on a limb and say a majority of California counties are on the call. And we're really pleased that it's both county advocates, outreach workers, the nonprofit sector, as well as our colleagues in county social services who run these programs every day. We're thrilled to have that partnership on this call. We will work. And we also have folks we know from across the country. I saw Colorado, Arizona, Idaho, Washington, D.C., so welcome to all of you. In today's webinar, I'm going to very briefly introduce the Alliance to Transform CalFresh and Same-Day Service, but I'm going to then turn it over to Vail Zuto, who's our expert from Intelligy Corporation, and we are thrilled to have Vail with us. She brings so much to the table in her breadth and her depth, and her commitment to the issue of customer service, particularly through California counties. I think many of you know, I'm hearing that there's some background noise in the call, and we'll try to address that. Thanks, folks, for letting us know. Maybe, Vail, you can mute your line until you're on in just a moment. Everybody else should be muted by the call service. Oh, that sounds better to me, so let's keep going with that. Thanks for the feedback, folks. And if you haven't already seen, there is a feedback button there for issues like that right away, as well as any substantive questions that will come up during the call. So thank you to those of you who jumped on that, and keep the feedback coming. So as I was saying, Vail brings so much. She has 18 years of experience as the founder and CEO of Intelligy, working with 19 different California County Health and Human Service agencies on customer service experience. She is also a leader in the County Service Center group, which helps counties share best practices across the county lines. And I would just say, not only does she have this operational depth, she's also really a thought leader in changing the culture, changing the norms around how we work together to deliver these programs and, of course, end hunger in California. So I'm just thrilled that Vail's going to give us so much of her time and expertise today. As I said, that'll be the heart of the call, and then we will finish with a quick review of some resources that the Alliance has developed, pulled together, and are still in progress that we need your feedback on, and then leave lots and lots and lots of time for Q&A. So that's what we're doing. Just briefly on the Alliance. Some of you may be new to some of you. We are a group that was founded in 2011, quite frankly, out of the shared frustration about why California's participation rate as measured by USDA continue to lag behind other states. And we set an ambitious but achievable goal of a 75% or better participation rate in 5 years. We have 7 founding members. I hope all who are on the call, and I hope are known to all of you: the California Association of Food Banks, California Food Policy Advocates, Catholic Charities of California, California Family Resource Association, Los Angeles Regional Food Bank, San Francisco Marin Food Bank, and Western Center. And just one moment on our approach. We have always wanted to be data-driven and get behind why the participation has stagnated. We also are consumer-focused. As consumer advocates, we are very laser-focused on the outcome of connecting people with CalFresh. We've coined this unwieldy word of statewide-ness, always a challenge in a decentralized state like California. How can we achieve statewide excellence? How can we preserve what's best about the county system and also make sure all consumers in all counties have the best possible service? And then alignment. We prefer to work in alignment with each other as advocates, with our county partners, with our state partners, with our federal partners, and as you hear on this call, the for-profit sector partners as well, because all of us are here for the same reason, to help people get CalFresh and to reduce hunger. So a little bit about us, and next slide, the 3 strategies that our group identified as key to boosting participation in CalFresh. 1, leveraging off of Affordable Care Act, most families in California, low-income families, are going to be eligible for both Medi-Cal and CalFresh. How can we make that a one-stop experience? How can we connect that dual enrollment, in-reach, doses of patients in one of our major goals? In a nutshell, almost everybody on CalFresh should be on Medi-Cal. 2/3 of those on Medi-Cal should be on CalFresh. Number 2, reduce churn by eligible families. Director Will Lightbourne identified this as a priority, and we heard from other counties and states who are working on this. We'd like to see 0 churn by families for administrative reasons. Of course, there will always be some eligibility churn for families whose circumstances change and their eligibility changes. But for those families who just are getting tripped up in the research process or the semi-annual reporting process or some other administrative process, we want to identify barriers and eliminate them. But the focus of today is the 3rd strategy, same-day service. How can we improve access, improve service on the front end to increase participation, reduce hunger, and all around improve CalFresh in California? So before we turn to the heart of the presentation, I just want to pause for a minute and say, why does this matter to consumer advocates? This may be obvious, but there's lots of reasons and why we think it's such a promising strategy and a win-win. First and foremost, I mean, I can't say it any simpler, families get food fast. That's what we from the food bank and other charitable organizations, that's why we're all here, and those in social services as well. Let's help people as fast as we can. But we also know that if the process goes on, we can lose people. We also know if the process goes on, people go to the food bank for another time or another bag or to a soup kitchen or to another emergency help because they can't make that rent check. And we really want to reduce the burden on social and charitable services if the social service safety net is available to them. We think, and this is of course not our area of expertise, but Vail is the expert, that this does lead to greater efficiency, which is a win for all of us. We get those federal funds turned on faster, flowing into our grocery stores. And, you know, this is doable. This is not a pipe dream. We're seeing this happen in some California counties and some states around the country. So without belaboring it, we're all about this strategy as a way to get better access to CalFresh and reduce hunger. So that was just a minute on the why. Now I'm going to turn it over to Vail for the hard part, the who, what, where, when, why, and how. So Vail, I've given you the introduction, and now I'm going to give you the floor. Take it away. One second while we work on our technology here. Vail, we're not hearing you. And one more second.
Okay, I think you can hear me now.
Yes, we can.
Okay, perfect. So thank you, Kim, and the Alliance to Transform CalFresh. I am very happy and excited to speak to you all. There really has been so much accomplished in the area of improving the customer experience in the last 18 months. Yet there really does there's so much more that needs to be accomplished. And today's topic, which is really same-day service, is a very good place to start. Let me just first start with a little bit about Intelligy and why I have been asked to speak. Intelligy specializes in collaborating with health and human service agencies to modernize and streamline the client delivery model. It really results in an improved client experience and increased staff efficiency. So because of what we do, I believe we've been asked to speak because we've worked with 19 California health and human service agencies over the past 12 years, focused specifically on service redesign for CalFresh, Medi-Cal, CalWorks, and GA benefits. So more than CalFresh. And we really focus on the customer, not necessarily the program. We're also involved in driving business process change and implementing technology to improve the client experience. And probably most importantly, we're really very passionate about making a difference. So here we go. Next slide. This is a slide that is a high-level view of the new and improved service delivery model that many counties have implemented. If you're a county, hopefully you have seen this slide before. There's been so much done over the last 18 months to improve service delivery. It is difficult to discuss CalFresh same-day service without first discussing the redesign efforts that have occurred. I'm thrilled by the great work the counties have done and the focus they have had on improving their client experience. It's truly amazing to see what has been done in such a short period of time. This slide shows at a high level the redesign work and how the counties we work with have modernized their customer contact and access channels for benefits issuance. As an advocate, you are a vital part of this process. In this model, a community-based organization is not only an access channel, but can also be vital to delivering assisted help. It's also important to note that we are serving the customer who potentially is using several services, not necessarily just a program. So starting from left to right, if you take a look at the access channels, the amount that has been added and opened up is truly amazing. A client can now call utilizing one number to get a hold of the county. There's also online access, so for self-service and web. There, of course, remains community-based organizations, and we're really working diligently for communication using text and email. There's mail, drop-off, handled at the point of entry, and there's also, of course, the client walk-ins into the lobby. Moving forward, a client comes in via one of these access channels, and the first stop now has been really self-help. And conceptually, the self-help allows them to get what they need as quickly as possible and as conveniently as possible. So there's recorded information, there's integrated case information online, there's online applications and case updates, and then there's also lobby self-help. There's phone-to-phone support, there's self-check-in, there's workstations for online application, and self-doc scanning workstations. So there's been a great effort to apply technology so that clients can come in and get what they need quickly. But the fact of the matter is that potentially the work that they need done and or the client themselves may need help with getting work done. So there is a great emphasis on assisted help. So both in-person support has been beefed up as well as phone support to help the client. Now that the client has received help in these ways, the problem then is resolved, and the model has changed in a great degree from case-based to either a task-based or what's called workload distribution today. So the client is supported up front, and then the work gets done in the back office in a task-based workload distribution model where it is efficiently broken into like tasks that can then get processed more efficiently. So phone interviews, both inbound and outbound, and we're going to talk a lot about that today. Continuing tasks, application support, in-person tasks, in-person interviews are some of the larger kind of work group areas in order then to issue benefits efficiently. So you can see in this model there's a great deal of effort for front-end services. Front-end services and support have become a priority. And in the back end, there's a shared and kind of flexible back office workforce via a workload distribution model where there's a flexible assignment of staff primarily based upon the client need. So really what that means is that in this model, staff is able to be moved to meet the needs of the client at the time. So as an example, the client has a tendency to call on Mondays. So we can put more people on phone support on Mondays. When the lobby is busy and the wait times are horrendous, there's an opportunity in this model to move staff from back office support into the lobby, get the traffic down, and then resume back to back office support in order to process the work that is done. So there's a tremendous emphasis on front-end services as a priority. The other important thing about this model is that measuring capacity, productivity, quality at each stage allows the management terrific visibility to both successes as well as where the process breaks down. And we'll talk a little bit about that as well towards the end of this presentation. So the service redesign is optimal for to set up really also and encourage dual program or cross-program enrollment. And so therefore, it is focused on the client. It's a client experience model, and the programs itself then are integrated in and hopefully produce the number of services or a greater amount of services that the client can access in a more efficient way. Next slide. This is a listing of the counties that have been involved in redesign and the stages that they are in. There are 19 California counties. Of those, 12 are CalWin. 15 have redesigned their continuing operations. All of them now impact both Medi-Cal and CalFresh programs, and 8 of those have redesigned intake and lobby also. Many are in the process of expanding their redesign efforts to all programs, and remembering that these are the largest and most complex counties in California, the results are both immediate and long-term. It will take another 18 months before the operations can settle into this new way of doing business, but I think all of them would agree that it would have been even more difficult to handle healthcare reform without improved processes and technology support. Next slide. So we're here today to focus on same-day service. Same-day service may actually be a misnomer, similar to the concept that you may have heard of one and done. The term same-day service is used to describe the approach of starting the application process in a matter of hours instead of days, when in contact with the client and get what is needed from that client on the same day. This may not actually result in the granting of benefits on the same day the application is received, but rather a commitment to process all applications quickly without what we're terming artificial wait periods based on outdated processes. The other thing to keep in mind is that the time clock for same-day service can also be dependent on the way the client enters the application. And we'll talk both about lobby or face-to-face applications and then online or phone applications, because they do have different processes. So next slide. So the big question is, with same-day service as a goal and the reality of limited resources with an ever-expanding need, how do we free up capacity to provide same-day service when before some counties were struggling to meet 30-day state-mandated deadlines? And really the answer to that big question is streamlined processes and improved technology. So the processes that have been streamlined in order to facilitate same-day service are: 1, minimize handoffs. So eliminate expedited screening. That was a very big and important one. Have app reg completed by the eligibility worker if the client calls to apply. Reduce and eliminate the scheduled appointment or artificial wait period, and we'll talk a lot about that. Same-day or outbound, inbound phone calls allow the interview to be conducted at the client's convenience. So really eliminating that artificial wait period, sending out the letter that says your appointment is in 2 weeks. And again, you'll see a process slide to talk about what was done in that area. Improved and reduced verification requirements helped a lot, as well as a flexible use of the staff, which I talked about in the previous slides. So front-end services as a priority, and a shared or flexible back office staff via a workload distribution model. And it allows a flexible assignment of that staff based upon the client need. So those are the main processes that have been streamlined. From a technology standpoint, online applications has been a big help. Automated reminders for renewals and verifications. self-check-in and scanning in the lobby and via IVR, electronic signature, as well as eligibility productivity improvements via technology has given and allowed an increased staff capacity. Next slide. So the first process that we wanted to talk to is really how has the lobby been redesigned and how has it been modernized. And fundamentally, the lobby, you walk in and it has been a process flow to make it more convenient to the client. I don't really want to do, and I'm not going to do a compare and contrast because you all know either where this experience has been in the past, and what you'll see in the next two slides shows a dramatic improvement in both the efficiency and the dignity of the client experience. So from a self-help standpoint, the client walks in, there's self-check-in, kiosks, and display monitors. If you have an appointment, there's a check-in with notification direct to that assigned worker. If you're a walk-in check-in, there's a notification into a lobby window, and then you'll be given an assignment and a window number that you go to, as opposed to everybody standing in the line to get served by the same amount of windows. So they're all broken into these 5 areas. So self-check-in, self-scanning workstations are now available with receipts provided. A client can come in and scan their own verifications, indicate document type and case number, and the client receives a receipt for that document. There's also lobby phones, and so the client uses the lobby phones to contact phone support for questions on existing case or about new applications rather than waiting in line. There's application pickup or drop-off. So an application packet is available to be picked up, filled out, and submitted or mailed in rather than standing in line to drop it off. And then there's lobby signage changes that have been very helpful. Communication on wait times and next steps, promoting online applications, phone support, and IVR self-help, as well as giving direction on where to go and what to do next. So self-help has been dramatically improved in the lobby. There's also been improvement in assisted help. So assigned eligibility staff is assigned the new applicant. They're performed at the interactive interview. They collect all the verification documents available. They can grant and deny benefits based on streamlined processing rules. So if you need an eligibility worker, the eligibility worker is there to help you. If you don't need an eligibility worker, there's self-help, and then there's also assisted help now through the clerical staff. So you can receive an application, you can get it time-stamped and imaged. You can review an app for completeness. A clerical person can help with requested additional documents. And you can also pick up your EBT or BIC card without having to stand in a very long line. There's now a separate window to pick up your EBT cards, as well as for GA, do your fingerprinting or CFIS. So the lobby experience itself has been very much so modernized, and which has been a big part in allowing and assisting in same-day service. If you go to the next slide, you'll also see that there are pictures of lobbies that you can see that there's a great amount of cleanliness and dignity. It feels professional. It feels clear. The signage is easy to read. There often are navigators in the lobbies to help with the kiosks and to explain the new flow. You can see the phones that are there. So there's just been a tremendous amount of modernization and redesign that has helped. Next slide. So the interview process is often really the single biggest deterrent to same-day service. And if a client is already in the lobby and they can or will wait, then they may now get same-day service. There's an assumption that the total amount of time expended may be longer than an online process, but the goal is same-day service or eliminate the need to come back to the office to complete the process. So here's the new process. A client submits an application in the lobby, and it's assigned to an eligibility worker. You can see on the upper left-hand side. If an eligibility worker is available, Then the EW will call the client from the lobby to interview, to an interview room, and the eligibility worker will clear and register the applicant or the app-reg process and conduct the interview. If benefits can be issued, then they're issued right away and the applications are processed. If they can't be issued, perhaps there needs requests for verifications or to get signatures, then the client is sent off to do that, and they can either mail them in or drop them off, and then they'll be notified of when they can pick up their EBT card, hopefully within the same day or next day process. If an eligibility worker is not available, at that time we will still want to scan the verifications, get the signatures, and schedule a phone interview. And within that process, what we're trying to do is eliminate the need for the client to have to come back into the office. This process is estimated to take about anywhere between 2 to 4 hours in the lobby, with the goal being same-day service. So next slide. So what's new? So in this process, there's no need to screen or triage for expedited service. With each client being seen by a worker on the same day, expedited service is identified as a part of the interview process. Workers do the application registration when available to eliminate handoffs. And if future interviews are required, for example, they came at the end of the day or the client cannot stay, a phone interview is scheduled, minimizing the number of times a client must come into the office. So all verifications that the client brought with them are imaged for future use. That's the face-to-face interview process. If you go to the next slide, I'm going to talk about the online application and phone interview process, which I think is the most exciting opportunity and is most client-friendly. The phone interview waiver opens up the opportunity to conduct the interview at the client's convenience. It's my belief really that penetration rates are lower than they should be, not because of the stigma behind CalFresh, but because of the difficulty of the task in obtaining the benefits. The phone interview, along with eliminating the need for scheduling, reduces the difficulty of the task in obtaining benefits and really is much more convenient to the client. In the counties that have been implementing this process for over 1 year, we're seeing over a 90% reach and completion rate. So the process starts when the client submits the application online or mails the application in. It is assigned to an eligibility worker before any appointment is set. Then if you go straight down, you'll see that the eligibility worker picks up the phone, makes that outbound call to conduct a phone interview. And amazingly enough, within 3 attempts, 90% of those clients are reached. And reached within the next day or same day. So if the client is available, the eligibility worker will conduct the interview and process the application. And then the client can come in and pick up their EBT card from a separate window, generally with shorter lines. If the client is not available, then the eligibility worker will leave a message with an inbound call to complete the interview. And the client is notified, the client is notified they will be also mailed out a letter that has an interview time. But the important thing here is that the client doesn't necessarily need to wait for that time. That's what we do in order to be compliant, but the client can then pick up the phone with the telephone number that is listed and call in to the interview at their convenience. So either from an outbound phone call or an inbound phone call, the client is contacted fairly immediately. So but the interview letter is still set. If the client hasn't gotten, if the eligibility worker has not gotten a hold of the client via the outbound call, the client has the opportunity to call back into the main number and go into an interview queue. There will always be someone available to conduct that interview, and it's conducted by the next available eligibility worker. There may be a slight wait in a queue, but there is a queue now to conduct interviews over the telephone. Once the interview is conducted, the application is processed, and if they are approved, then benefits will be issued and they can pick up their EBT card. So the next slide, what's new about this process? The client is called the same day or the next day after the application is submitted, before an appointment is set, which eliminates waiting for clients to receive an appointment letter for the process to begin. That's that artificial wait time. An outbound call includes conducting the interview, and multiple outbound call attempts are made, and leaving a generic voicemail when the client is not reached. Future interview appointments set only as a last option, and minimizing missed appointments and scheduling cycle. The client is also given the option to call in for a missed phone interview and conducting the interview at the client's convenience. Next slide. The technology involved in use for improved same-day service, there's a lot. There's a lot, and there's also more. Enhanced call center technology, inbound, outbound queues for missed interview appointments, prioritized clients, or a client can be prioritized within a queue. There's call review, workforce management, and reporting by time of day and day of week. And that reporting by time of day, day of week, is what then allows us the knowledge and the information or the data to know how to flexibly apply the staff, i.e. Mondays are heavy phone days, Tuesdays are often heavy lobby days, Fridays can be heavy lobby days, so we'll know how to deploy the staff based upon the client needs from that enhanced technology. There's lobby management systems, so streamline the client experience, immediate check-in of clients, and queue to get the right service with the first contact. There's also upfront document imaging, access to mailed or dropped off or electronically submitted documents are scanned, and they're available in document imaging at the point of access. There's automated call reminders, so you can remind clients of appointments. There's for reporting in the star 7 the renewal when the renewals are due, and then if there's task management systems or workload distribution tools that track and assign all eligibility work, intake, and ongoing both. And then there's dashboard reporting. So dashboard reporting is very much so being discussed today. It's a data-driven world. But there's not a lot of consistency on dashboard reports or reporting in general. So what we believe is that there are 4 clear areas of dashboard reporting: operational, client experience, compliance, and financial metrics are recommended. In the next few slides, so next slide please, we're really in the midst of the data-driven decision-making revolution. So the next few slides, I'm going to talk about really what it is, what's in the battle. You know, like any good revolution, there are various opinions and battles before we have consensus. All of that to say that there really are no standards for metrics and reporting in this new world that we're in the new service delivery model. There's only the desire to create them and ideas on what those metrics should be. As mentioned, that we believe there are 4 critical areas of reporting, each of which should have its own dashboard as well as drill-down reports. Intellige's area of expertise is in the operational and client experience areas. So I have a few definitions here that I hope shed light on the data-driven revolution. There are operational reports. So those are really what are the production of work, KPIs or key performance indicators, that provide visibility to the quantity and productivity of the work being performed. Then there's the area of the client experience. What are the customer satisfaction KPIs that provide visibility to the experience your customer has with your organization? Then there's compliance. What are the program integrity and compliance KPIs that provide visibility to the department's compliance with the state and federal objectives and standards? And then there are financial. What are the financial KPIs that provide visibility to the budget allocation and resource parameters of your organization? Next slide. I have a few slides here that are examples of operational and client experience dashboards resulting from the availability of data in real time. This particular report really looks and talks to same-day service. So the desired standards of expedited service and average day to process, the state and federal requirements of 3 days, represented IntelliG clients are really processing them in 5 days. So those are actual results. Average day to process an application, generally 30 days. They've been reduced to 7 days on an average, so that's a pretty great number. Excited about that. CalFresh error rates, less than 5%, still looking to be less than 5%. Percentage on time triple R's, less than 90% on time for 3 steps, and meeting those standards at less than 90%. But here's some new standards, new measurements, and we call them client experience outcome measures. And that's looking at how well is the client being treated. So what's the average lobby wait time or wait to check in? It really has never been measured before, but after a redesign effort, it looks to be about 15 minutes, and before the estimate was 30 to 60 minutes. So redesign has been very successful. The average number of clients in the lobby per month really is dependent upon the caseload, so there's no real benchmark for that. But what we've seen after redesign has been a decrease in about 20 to 30%. And we see that growing literally every day. Same-day interview, before the 5 to 15-day average return for an appointment, and after redesign, about 90% have the opportunity for same-day service and are receiving it. So it's a really great number. Average days to interview appointments, anywhere between 5 and 15 days, average for a return appointment. After redesign, 1 day. Average reach rate on the outbound interview never was measured because it didn't exist. And after the redesign, we're seeing about a 92% reach rate. Online appointments, our applications as a percentage of total applications, about 10 to 15% after 1 year of implementation. And after redesign, it's growing to 23%, and I've seen as high as 35 to 40%. Phone call handling, average speed of answer. The service center best practices is less than 1 minute. Nobody has been hitting those numbers. With the Affordable Care Act and the incredible increase in the amount of clients and phone calls, I've seen anywhere between 20 and 45-minute wait times. After redesign, it looks to be about 90 seconds to 10 minutes, really due to a significant spike in call volumes. What you're going to see on the following few slides are really examples of operational and client experience dashboards resulting from the availability of data, and much of that data available in real time. So the next slide shows you the access to real-time data. You have lobby management data and what the current wait times are. You've got task management data that allows you to see how many tasks are in queue as well as how many can be processed. And then you also have phone or automatic call distribution data that shows in real time how many calls you have, how many are in queue, how many people you have logged in. So it gives you the information to be able to act and react in real time. The amazing part about that is data for the most part has always been in arrears. A week in arrears, a month in arrears, 3 months in arrears, to have access to this real-time data to react immediately has really improved the client experience. The next few slides are examples of summary reports and dashboard data. So you have client experience data, cases and application volumes for both continuing and intake, and really looking at the percentage of change. The data in here is not real. It's we have multiple clients that keep their data confidential, but it's the type of data that we're recommending for dashboards and for client experience tracking. Access channels for new applications. So where are we seeing clients are going? And then what's the percentage of change? Are they using the phone? Are they coming in from the quick sort transfer? Are they walking in person? Are they online? Are they mailing in? And how is that changing as a percentage of the total from last month and last year? There's also, up to your right, benchmarks for functional volume projections. So looking at calls, for example, and looking at them as a ratio of continuing cases. And that's important to know so that we can see how often are our clients contacting us. And the amount of contact has gone up exponentially as the amount of access channels has gone up. And I think that that's a really big win for the client experience. The clients no longer can just feel like, I can't get a hold of a worker. I have to, stand in line to wait for my eligibility worker. I have questions. I have to take off work to get them answered. No, the amount of access to the counties has increased dramatically. So we're trying to track that so that we can be prepared, and the counties can be prepared to know where to staff and what to do. So looking at ratios of, for example, calls per continuing case ratio, both current and projected. It used to be, when we first started, it was maybe 30% of cases would call in on a monthly basis, and now it's up to really above 50%. Walk-in volume and case and application ratios we're tracking. Task per case ratio and tasks per application ratio is also being tracked. And then application performance measures. How many processed within 45 days? CalFresh apps processed within 30 days. ES apps processed within 30 days. So really looking and tracking the client experience measurements. The next one are operational dashboards. And I won't belabor this too much. Next slide, please. But there's functional data that is looked at from both the lobby as well as the inbound call handling, the interviews, and the tasks. And it's important to track this so that we know, one, how well we're serving the client, and two, how productive we are as an organization. So looking at the different lobbies and how they perform differently from both the service counter and new applications as well as appointments, and then looking at them as a total and a percentage of the target as well as the average wait time relative to the goal. Inbound call handling, calls that are offered, calls that are answered, what the service level is, and what the abandoned calls are, as well as what is the average handle time of that call. And those are important because knowing the average handle time, if a call takes 12 minutes but we projected it to take 6 minutes, that's going to result in more wait time for the customer because each call is taking longer. So really utilizing this data in a way that allows us to make decisions on how to deploy staff, how much staff we need, and where the clients are being served and potentially where they're not being served. Next slide, please. And this is also the last slide on examples of and this one is operational staffing and productivity. So looking at staffing and productivity data, how many staff do we budget? how many hours does that give us, and how many are on the job, and then how many are really always were available to work during that time period. There's usually a gap there. Eligibility staff hours by function, and then staff productivity by function. So really looking at those numbers allows us to increase capacity, and therefore that's what gives the counties the opportunity to perform same-day service. So the more they can increase capacity of the current staff, the more opportunity they have to do same-day service for the clients. So that's just a view to the operational dashboards as well as the processes involved with same-day service from both face-to-face as well as the phone interview process. If you go to the next slide, Kim asked me to give a few comments really on what can the advocates do to promote improvements in service. And so really with your clients, encourage and educate, continue to educate clients on the use of the online and the self-help service. It's available. It can be intimidating the first, second, or third time that you use it, but the fourth time or the fifth time or the sixth time, if you continue to use those online services, then it becomes a more convenient opportunity for the client. Understand and communicate the available access channels and the responsibilities of the client to issue benefits in a timely manner or same day. Really, what verifications do you need? What do you need to have in order to get your application processed in the same day? And that's why same-day service is a misnomer, because we don't control, the counties don't control what it is that the client shows up with. They've worked very hard to improve efficiencies and to create processes that are client-friendly and improve the client experience. But the client does have a responsibility to be available and to show up with the appropriate verifications and fill out the applications in a way that allows their application to be processed quickly. What can the advocates do with county partners? You can promote sharing of best practices with county to county. You know, for example, the phone interview and sharing of data. Not every county is doing the phone interview process in this way. It's a new process. Some are and some aren't. So you can be a real advocate with your counties in helping them to understand best practices across all counties. Discuss horizontal integration as important to the client. Ask your county partner what processes are in place and how they are measuring success in this area. The Affordable Care Act has been successful beyond our counts, beyond the estimates that were given, and so there's a sense of backlog, and there's a sense of a lot of work to catch up on, and therefore cross-program applications and horizontal integration has been a secondary to just getting the application processed. So we do encourage the horizontal integration and the concept that it is important to the client. We can't forget that. So ask the county partner what processes are in place for that. And then last, encourage a standard set of metrics across counties and at the state level. It's very, very timely. Data-driven performance management, data-driven decision-making is very, very key and talked about, but there aren't real decisions and there aren't real standards right now for what can be done in the area of data, the use of data, and the sharing of data. So that's all I have for you today, and thank you for your time, and I'm happy to take some questions with the time you have available.
Thanks, Bill. And we do have a lot of questions that have come in that we'll get to just in a minute here. I want to take that last slide of yours and just add a couple of notes about what the Alliance believes is the advocacy agenda around this at the state and county level, and some tools we're working on with San Francisco and Marin Food Bank to help folks do that. So next slide. We have developed a fact sheet. All of this, I'll give you the webpage where it's posted at transformcalfresh.org. We are recommending 3 statewide initiatives to advance same-day service in the state. First, we believe there do need to be some statewide metrics and standards that come out of the county's experiences with what works. We have a number of counties who've been doing this, and we think together they can hammer out a shared set of standards and metrics that we can all use to benefit all consumers. Two, there seems to be a wide consensus, both nationally and within California, that our verification system is slow and old, and the big burden between getting to true same-day service. It's possible to do an application, to do an interview, but the verifications can really slow things down. So what can we do to modernize technology? We're doing more electronic collateral verifications. The new form, the 2200 that everyone should have seen this fall, is now in use as a great step forward, but we'd like to see more modernization on this front. And then third, I think as folks know, the state has been engaged in a work group on expedited service, and we'll be issuing a all-county letter with best practices and model scripts and model processes to improve and standardize expedited service statewide. Well, many of those practices, things like the outbound phone interview, can be adapted, can be extended rather, to all clients. So as people are rethinking ES, we really strongly encourage folks to apply that to all their consumers. Moving quickly on the county agenda, at the risk of being glib, next slide, what we want all counties to do is to move to same-day service as fast as they can. And I know it's easier said than done, and as Vail says, this takes time. But we do think there's a role for county advocates in partnership with their counties. Find out how the current systems are working, do some homework, do some mapping, find out what data is currently being used, what can be shared about the consumer. Again, not on the worker, not on the fiscal, not on the compliance. Our interest is in the consumer experience at this point. See what goals have been set. Look at what the process is, and as anyone will tell you who's done this, we heard this in Washington and Oregon when we visited, and some of the California counties too, of course. It's ongoing. It's never ending. You work on one process, you work on another, a new technology, a new rule change, but continue that process of driving toward same-day service. There aren't policy barriers that are keeping counties from doing same-day interviewing, that are doing outbound calling, that are doing some of those best practices. That aren't policy barriers. There are other barriers for sure, but there aren't policy barriers. And in that spirit, we have begun to develop some tools under the leadership of San Francisco Marin Food Bank. And I'm just going to give you a quick preview. The next slide is the first one, which just is a graphic showing the three types of service: a regular service, for want of a fancier word, expedited service for those who are determined entitled to it with an urgent need, and this new concept of same-day service. Vail's absolutely right. Different channels need different bars, but this is a good, we think, intro to what we're talking about, can help you begin to break down the process. With this document and all of these kind of worksheets, we really invite feedback from our county partners, from the state, from county advocates on what would be helpful to you. This one's on our website, ready to go. We have two others I want to just give you a little preview to. We're working on a worksheet based on those rows where there was some questions. So what portion of applications are coming in online or by mail or in office in my county? What's the average lobby wait in my county, the different offices? Can you call in for an on-demand interview? Questions like that can just be a great way to start a conversation with your county, get a tour, get behind the desk, as we say, and learn more about the consumer experience. A third document we have in progress is kind of a checklist. Again, we welcome your feedback on this. We really encourage you got to get in there and see the process, understand the process, both from both sides of the counter, if you will. Map out the steps. Ask the county what data they're tracking for consumer outcomes. Connect this up to client stories. So many folks of you are doing outreach, and so you have anecdotes or qualitative. How does the qualitative experience you have with clients connect with the quantitative data? And in fact, we always, we're so struck by the Oregon Food Bank that in partnership with Oregon Social Services has been running a secret shopper program for years to just gather more information about the consumer experience. Of course, once you have that data, you got to track the outcomes. This could be, San Diego has a great data dashboard shared publicly with their County Board of Soups committee so that everyone can see the key consumer outcomes for the program, which is a wonderful model. This, again, should be open public data. And then what's your county? What does the county need to be successful? Is it a policy change? Is it a visit to another county to see how it's done? Is it a technology upgrade? But is it consulting? But work with your county to see what are the barriers that are in the way of delivering same-day service to all the consumers in your county, and how can you help? And then I urge you again, we are not trying to build 58 different model counties, although that would be one way to solve this problem. We really are trying to get to a statewide aligned approach where we have common metrics, common standards, and a common service of excellent quality for all consumers. So join us in the statewide advocacy. With that, I want to we'll turn to Q&A. All those resources I've mentioned to you and more, including the PowerPoint, and the PowerPoint and recording are not up yet, will be shortly, but the fact sheet, the toolkit, and the other information from our colleagues at USDA, CDSS, and the other Western states doing this are posted. And if you know of more, or if your county has more to share, please email us, and we will put it up. We'd love to have a real one-stop place. Okay, so questions. Vail, there were many. I want to just go through several on technical issues. First of all, to clarify on expedited service, you said eliminate the screen, but the second time around you said to really move it to the interview. So it's not so much that it doesn't happen, but it doesn't happen as a separate upfront step. Is that correct?
That's correct, yes.
Okay.
What was found in the research is that the vast majority of clients were expedited, so why are we bothering spending those cycles and that time screening for them? Let's just interview them all. Yep.
And on your data page, you actually said your times were 5, but it said 0.5. I want to make sure everybody saw that the expedited service time on that slide was 0.5, a half a day. There were questions about telephones. It's okay. There was a question, is it permissible for someone to do a whole application over the phone?
It is permissible. Quite frankly, we don't recommend a phone application. It takes a very long time. But it is permissible. It was one of the areas that was mandated by the Affordable Care Act and by particularly in California. So yes, it is permissible.
For CalFresh?
For Medi-Cal.
For Medi-Cal, yeah.
I do not have that information on CalFresh, but if you can take it on Medi-Cal, I would assume you could take it on CalFresh.
Yeah, let me follow up on that, because I think that has been an issue, and of course CalFresh has a different telephonic signature requirement, so that has been an issue. But it's interesting to hear you say, from a consumer perspective, it's not the fastest door anyway.
It's not.
One of the questions we've had is, how can counties get phone numbers from clients? For so long that has been really communicated that that's not a requirement to get that, but then I hear you say, boy, it's the most helpful tool in a fast process. How are counties getting that information from clients?
Well, we're asking for it. The counties are asking for it, and in not only home phones, but really focusing on cell phones, because you have the whole text message reminder that has been so helpful for triple R's and STAR 7 and the renewal rates, that we're asking for it and continue to ask for it. There's a movement in the call centers that whenever someone calls in, then we go through a standard set of questions, just like the private sector does. You know, is this your phone number? Is this your address? Just to verify and continue to verify information.
We've had a couple people from different counties say, boy, their online application is cumbersome. Have you done any work on the user experience of just the application itself?
Well, one of the, so no, we've not been able to impact the user application itself. There is a lot of interest in looking at the user application and trying to streamline it. There's so much information that is required to be given. There's a lot of information that is asked for 2 or 3 times by requirement. There's a group called Code for America that I saw a presentation at just last month, and it was really refreshing. It was fun to watch, and they just made a little bit of fun of how cumbersome the application process is. And so I think that there is a lot of interest in trying to streamline the application, but as you all know, it's not like just because you want to, you can. there's a lot of regulation involved with making that happen. So I do believe that See for Yourself is a different application than benefits CalWin.
Right.
And so there may be differences in functionality and ease of use. And so those differences can be changed, but the actual information required both to give and to get is fairly regulated, as you know.
Well, that may be another state priority for us to look at, because there was a really intensive work group process around redoing the paper application to make sure the paper app was as best as possible. And it sounds like there may be an opportunity or even a necessity to do that around the online app, given the questions we're getting and that update on the Code for America presentation. So we'll definitely follow up on that.
Yeah, if the paper application is streamlined, which I don't believe it's actually done yet, then the online application will quickly follow suit.
Yes. A couple questions about how, let me ask you this. You mentioned at one point 18 months when you're looking at your list of counties and implementing. What's going on in that 18 months, or why 18 months? Can you talk more about that implementation transition period?
Oh, that's a good question. Change is difficult, and we are in the midst of a culture change that is not only people change, but it's also how we do our jobs and the access to information that we have to do our jobs. So just because, you know, just because the consulting organization says this is the way it should be done and really it'll be more efficient doesn't mean that the next day that's how you're doing it. Change is hard. And so the 18 months is everything from let's make sure the technology is working properly. Now that it's working properly, are the staff using the technology in the way that it needs to be used? Is the staff doing the different processes that are in place, and what questions do they have? It's human nature that if there is a problem or you get bogged down, you revert back to what you know. And so it just takes 18 months to work through doing your job a different way. And in that 18 months, some people complain. And so is that the majority? Is there really a problem with the process, or is there just a problem with this one little piece of the process, or one client who isn't understanding what they need to do now? So it takes a while for those issues to pop up, be analyzed, implementation to take hold, changes and tweaks that need to occur, and then there's always continuous improvement. The beauty behind the new model that utilizes technology, that distributes work amongst a variety of staff, is that you really now have a terrific opportunity for continuous improvement and continuous improvement.
Well, I can't think of a better note to end on than the one about continuous improvement and culture change. We really are in an epic moment where we are working to how can we help the family with as many programs as possible with as little burden as possible while preserving accuracy and integrity. So it really is a wonderful moment. There are several other questions that we will follow up one-on-one, either myself or Vail. Thank you so much. And thank you to Vail again for providing the heart and the brains behind this webinar, to the work group at ATC who made it possible. Thank you, my friends. And of course, our funders who make all of this work possible. Thank you. Continue to check our webpage for updates, and we'll be in touch around future webinars and opportunities in the new year. Thanks so much.
Thank you.